Hello guys, welcome to my channel. As a man, when a lady tells you that she has missed her menstrual periods, either that lady is your child, your girlfriend or your wife, the moment they tell you that they have missed their periods, what comes in our mind is that the lady is pregnant. But do you know that there are many other things that can make a lady to miss her period apart from being pregnant? On the other hand, as a woman, missing your menstrual periods can be very devastating and very stressful, especially in situations whereby you have missed your menstrual periods and you have done a pregnancy test and you have found that you are not pregnant, yet you have missed your menstrual period for at least 6 months, 8 months or even 1 year. It will be more stressful because you'll start questioning your fertility. So in this video, I'm going to talk about the different factors that can cause you to miss your menstrual periods in situations whereby you are not pregnant. So welcome, and remember to subscribe because in this channel is where you can find health-wise educative videos. So without wasting more time, let's go to the video.
I be so sick of you niggas, y'all contradicting. I be so bored myself when you come and fuck me. I feel so ordinary, except when you around me. Treat me like corduroy, you wear me out. Arguments, you air me out. Tripping about you.
So in this video, I'm going to discuss about amenorrhea. Amenorrhea is a condition, it is not a disease. It is a condition whereby you find a lady has missed her periods. It's literally referred to as missing your menstrual periods. So anywhere you hear me mentioning amenorrhea or amenorrhea, just know that I'm talking about a situation whereby you have missed your menstrual period. Different ladies have different menstrual cycles, but the average menstrual cycle is a cycle of 28 days. But we have other ladies who have as low as 21 and others who have as high as 35. As long as you are between 21 and 35, there is no need to worry. All ladies, majority of the ladies lie between these two numbers. When you get below 21 day cycle or above 35 day cycle, that is when you can become worried. But majority of the ladies fall between 21 and 35, which is regarded as a normal. So each menstrual cycle, your womb or your reproductive system prepares itself for pregnancy. Each menstrual cycle or each cycle, your body or your womb prepares itself for pregnancy. So whenever the pregnancy does not occur, whenever you have completed your cycle and the pregnancy has not occurred, that's when the ovum or the released egg and the uterine debris are released outside the body in form of blood. That is what forms your menstrual periods. So there are 4 circumstances in a woman's life. There are four times in a woman's life whereby having amenorrhea is considered to be normal. So number 1, during pregnancy. During pregnancy, you find that the reproductive system and the hormones being produced focuses on the growth and development of the child. The other place is before puberty. Before puberty is also called adolescence. So before adolescence, you find that the reproductive system of the lady has not yet matured and the essential hormones which are used in menstruation have not yet started being released. The other period is during breastfeeding or lactation. There is something we call lactation amenorrhea. So during breastfeeding, there is a hormone called prolactin. This hormone inhibits or stops the ovulation. So whenever you are breastfeeding within the first 6 months, you will not have your menstrual periods. The last period is after menopause. We find that women are born with a certain number of eggs, and in each menstrual cycle, 1 egg is always released. So at menopause, all the eggs or most of the eggs the woman had will already have been released, and also the hormones which are essential for the menstruation will have stopped being produced. So when you have missed your menstrual periods but you are not under the four circumstances which I've mentioned before, you are not pregnant, you are not breastfeeding, you have not reached puberty, or you have started your menopause, that's when we can refer you to as having amenorrhea. There's a difference between missing your menstrual periods and delay of your menstrual periods. We have some ladies who can have a delayed menstrual period to up to 3 months, but as long as you are having a regular menstrual cycle, there's nothing to worry. But the moment you have missed your menstrual cycle, your menstrual periods for a period of 6 months, that's when you can become worried. That's when you can say that now it has become abnormal and will classify you as having amenorrhea. So for the purpose of understanding this video, we must understand the factors that come in place before you experiencing a menstrual period. So there are things that must be present for you to experience a menstrual period. So number one, we have the reproductive system, the female reproductive organ. Of course, males cannot have the female reproductive organs, so we must have the female reproductive organs. Number two, we have hormones. So in terms of hormones, we have the glands which produce the hormones. The first gland, which is a great contributor to menstruation, is the pituitary gland and the hypothalamus. The pituitary gland is considered as a master gland. We consider the pituitary gland as a master gland because it controls other glands. It's the one that controls the ovaries and the hypothalamus to release the hormones. It is the one that tells them the time to release the given hormones. So number one, we have the pituitary gland. Number two, we have the hypothalamus. So the hypothalamus releases two types of hormones. We have the follicle stimulating hormone and the luteinizing hormone. We also have the ovaries. The ovaries release two hormones. We have also estrogen and progesterone. So for one to have menstrual periods, all these factors must come in place. Dysfunction of any of the factors of the hormones or of the glands might make one not to have her menstrual periods. We classify amenorrhea into two, whereby I've said amenorrhea is a period whereby you have missed your menstrual period. We classify it into two. We have primary amenorrhea and secondary amenorrhea. Primary amenorrhea is a situation whereby you have not yet had your first menstrual periods since you were born. On the other hand, secondary amenorrhea is a period whereby you have been having a regular or an irregular, you started having your menstrual periods, but now you have missed your menstrual periods. That's when you can say you are having secondary amenorrhea. So I'm going to deal with the factors, with the primary amenorrhea factors before I go to the secondary amenorrhea factors. In primary amenorrhea, we find that this lady has matured sexually, he has undergone puberty, and the secondary sexual characteristics have been developed, but the lady has not yet started having her menstrual periods. We diagnose somebody of having primary amenorrhea at age 17. So from age 0 to 17 to 16, we consider it normal for a lady not to have menstrual periods. But the moment that lady clicks 17 and she has not yet started having her menstrual periods, we now consider that lady as as having primary amenorrhea. So if you have a sister who is below 17 years and she has not yet started having her menstrual periods, there's no need for you to worry. Just wait until she clicks 17 years. That's when you can say now she is now missing her menstrual periods. So under primary amenorrhea, there are two factors which can cause one to delay in starting her menstrual periods. So number one, we have hormonal disorders, hormonal dysfunction. Number two, we have developmental abnormalities. So under hormonal disorders, we have dysfunction in the hypothalamus and the pituitary gland. As I have said earlier, the pituitary gland is the master gland, and it's the one that controls, that tells the hypothalamus to start releasing the follicle stimulating hormone and the luteinizing hormone. So when you have a malfunction of the pituitary gland, when it stops functioning or it does not function normally, or it has not been developed properly, that's when it will delay or it will not direct the hypothalamus to release the hormones. And we find that the two hormones which I've mentioned before are essential. They are the ones which initiate the menstruation cycle process, the menstruation process. So without the two hormones, somebody cannot have her menstrual periods. So number 2, under primary amenorrhea, we have developmental abnormalities. As I've said earlier, the female reproductive organ, which contains the ovary, the uterus, the cervix, and the oviduct, is important before, it's essential for before someone can experience her menstrual periods. So any abnormality, either when they are not formed properly, before someone is born, when the organs were not formed properly, whereby you find that somebody does not have an ovary, does not have a uterus, or any abnormality in the development, will cause someone not to have her menstrual periods. So under developmental abnormalities, we have 3 conditions. I hope we are together. Under developmental abnormalities, we have 3 situations that can cause someone not to experience her first menstrual periods. Number 1, there is something we call imperforate hymen. So number 1 under the developmental abnormalities is the imperforate hymen. A hymen is a tissue that develops in the vagina. It is the tissue that is ruptured when a woman experiences her first sexual intercourse. It is the tissue that is destroyed, or that is what can I say about it? It is the tissue that is, it is the one that is I don't have the correct word for it, but it is the tissue that breaks. Yes, it is the tissue that breaks. It is the tissue that when it breaks, someone is now considered to have lost her virginity. So sometimes that tissue is developed in a way that it covers the vagina, whereby it prevents the movement, it covers the way of the vagina to the extent that it blocks the entry and the exit in the vagina. So under such circumstances, but you also have to know that not all ladies develop the hymen. It only develops in few. So it is not abnormal when you do not bleed during your first sexual intercourse. So in this situation whereby I'm talking about the imperforate hymen, this is why it has blocked the entry and the exit of the reproductive system. So under this circumstance, you will find that the lady will be experiencing all the abnormalities of menstruation, but the lady will not be seeing her menstrual periods. The lady will be menstruating, but all the products of menstruation, all the blood will be accumulating behind the hymen. So the lady will be complaining of abdominal pains and absence of menstruation, of the menstrual periods. So with time, as time goes by, you'll find that more blood will continue accumulating behind the hymen. So the more it accumulates behind the hymen, you'll find that this lady will have a distended uterus, which is very painful. So the lady will complain of pain, and also she will be complaining of absence of menstruation, of menstrual periods. The treatment to this condition, the treatment to imperforate hymen, is incising the hymen. It is a surgical procedure whereby you go to the hospital and the doctor will incise and cut off the hymen to allow the exit of the blood. So after incising, that's when you will have a way, it will open up whereby all the contents of the present behind all the blood that accumulated behind the hymen will be released. So under this situation, the lady will be advised to maintain a high level of hygiene. The second factor in developmental abnormalities we have is called pseudo-hermaphroditism. Pseudo-hermaphroditism. This is a condition whereby a male develops in a female body. I don't know if you'll be able to understand. This is whereby you see that a male develops in a form of a lady. I hope you have seen such kind of people. They are more masculine and they behave more like men and like women. So they have more masculine characteristics than the feminine characteristics. So in this situation, we'll find that person will be having more masculine, more testosterone, which is the masculine hormone, than the estrogen and the progesterone. So such people do not undergo menstruation because the hormones they have is not sufficient enough for it to initiate her to have menstruation. At the last under developmental abnormalities, we have Turner syndrome. These are ladies who only have one X chromosome. We find that men always have an XY chromosome and ladies have a double X chromosome, XX chromosome. But in Turner's condition, we'll find that this lady will have only one X. Under this condition, the lady will not have her menstrual periods. I've talked about the primary amenorrhea, whereby I've talked about hormonal abnormalities and developmental abnormality, whereby under developmental abnormality, I've talked about imperforate hymen, pseudo-hermaphroditism, and Turner syndrome. So any moment or any time you see your sister has grown or your girlfriend has grown, but she has not experienced her first menstrual periods, probably the main cause, the thing that will be the cause, is that she'll be having the three which I've mentioned. So let me now go to the secondary amenorrhea. This is where now majority of ladies lie. So let me now talk about secondary amenorrhea. So I've said earlier that secondary amenorrhea is a period where it's a condition whereby a lady has been having a normal menstrual periods, but now this period have ceased or have stopped coming. So what factors can cause a lady who has been experiencing a normal menstrual cycle to now not get her menstrual periods? So the most common cause of secondary amenorrhea is pregnancy. The most common cause of secondary amenorrhea is pregnancy. So under secondary amenorrhea, you must first rule out the four things which I've mentioned earlier. You must rule out pregnancy, you must rule out menopause, you must rule out pre-puberty or ages whereby you have not started developing your secondary characteristics, and you must also rule out breastfeeding. So after ruling out these four, that's when you come now to look at the characteristics which I'm going to tell you in this video. So the first cause of secondary amenorrhea is stress or nervous disorder. You can call it nervous dysfunction or nervous disorder, but the common thing that we can call is the common and the simple thing that we can call it is stress. So under stress, we have three types of stress. We have physical stress, we have emotional stress, and we have psychological stress. So under stress, we find that any form of stress, either emotional, psychological, or physical stress, acts on the hypothalamus and inhibits the hypothalamus from releasing hormones. So under any form of stress, your hypothalamus will not function properly. So under physical stress is whereby you find those two are bodybuilders. We also have marathon runners. You understand that a marathon is a 42-kilometer journey. So those people who train for marathon, most of the time they train a lot. Imagine running 42 kilometers maybe once per day or twice per day. So your body becomes so tired. So exposing your body to that levels of physical stress will impact your menstrual cycle. The other type of stress is emotional stress. This mostly happens to adolescents or young girls. It happens in situations whereby, for example, a lady has just joined college. She's in a new environment whereby she's not used to, or she has just joined college or joined university. They have changed home, or they are now living in boarding school, or they are being given a lot of schoolwork. So if you have your sister and she has just joined high school, boarding school, and she tells you that she has stopped experiencing her menses or her menstrual periods, you must just understand that the change of the environment might be a contributing factor, will be the contributing factor to that. So whenever your sister or your friend tells you that she has missed her menstrual periods, do not just rush and conclude that they are pregnant. So the final type of stress is the psychological stress. This now cuts across all ages. So when you miss your menstrual periods, you must assess yourself. Are you undergoing a form of breakup? Or have you lost someone? Or are you overthinking about something? Are you undergoing any form of psychological stress, or you are not settled? You must know that such things contribute to the psychological stress, which will cause you to not to get your menstrual periods. The number 2 cause of secondary amenorrhea is hormonal factors. We have dealt with the hormonal factors in the primary amenorrhea. So somebody might ask, this person has been having a functional hormones, the hormones have been released, or the glands have been normal. What has caused them not to continue releasing those hormones? So this person has been having normal menstruation. So what factors can impair or can damage the pituitary glands, or can interfere with the production of the hormones? So number 1, we have collapsing or fainting. Collapsing is simply fainting. When you collapse for a long period of time, you will find that it will impair the supply of oxygen to your brain. So when the tissues of the pituitary gland do not get the sufficient oxygen, they might undergo cell death. Some of the tissue in the pituitary gland might die to the extent that it will make them not function. On the other hand, we have postpartum hemorrhage. Postpartum hemorrhage is whereby you bleed a lot during childbirth. So when you bleed a lot during childbirth, you might lose a good amount of blood. It will also act the same way as collapsing, whereby it will inhibit the amount of oxygen being supplied to your pituitary gland. Other factors that can interfere with the functioning of the pituitary gland is stroke. Stroke, in other words, is called cerebrovascular accident. This is whereby you bleed in the brain. So we also have brain tumors. These are growths that happens in your brains. So number three, we have something called dietary amenorrhea. This is for those ladies who are trying to maintain their body shape, so they fast a lot. They do not eat for a prolonged period of time. So when you fast to the extent that you lose weight, you will have malfunctioning in your menstruation. Also, if you do not eat well, you do not eat a balanced diet, probably either intentionally or unintentionally, for those girls who come from poor backgrounds, whereby they cannot afford the basic food, they will have problems with the menstruation. The other thing we have is chronic illnesses and anemia. Chronic illnesses The other term for chronic illnesses is prolonged sickness. So our bodies were made in a form in which they focus. Their main focus is always on survival. So when you are sick, when you have been hospitalized for a period of at least 6 months, it is only 6 months whereby you can say that this person has been having a chronic illnesses. Most of these diseases are cured within the first month, few weeks. But when you are sick for a long period of time, for up to 6 months, that's when we can say you are having a chronic illnesses. So when we have been hospitalized for long, our bodies are meant to focus on survival. So the body might focus on survival to the extent that it forgets to focus on the menstruation. So anytime you miss your period, you must consider if you have been admitted in a hospital or you are facing a long-term illness. An example of a long-term illness is a TB, tuberculosis. Tuberculosis is treated for at least 1 year. You have to take the medication for at least 1 year. On the same, we have anemia. Anemia is when you don't have enough amount of blood in your body. So when you don't have the enough amount of blood in your body, and our bodies are focused on survival. So the body, you must know that menstruating involves the losing of blood. So when you have low amount of blood to lose, the body might not allow you to lose any more blood because it is conserving the little amount of blood that is remaining in your body. Number five, we have the use of contraceptive drugs or the use of hormonal contraception. When you are under any form of contraception, when you are using any form of contraceptives, either the Depo-Provera, or you are using the emergency contraceptive pills, the Jadel and implants in general, or the hormonal IUCD, you must know that it is normal for you not to experience your menstrual periods because the hormones inhibit ovulation. The mechanism of action of the hormones, they work in a way that they inhibit ovulation. So when they inhibit ovulation, they will also inhibit menstruation. Ovulation is the process of the release of an egg from your ovaries. That's what I'm referring to, ovulation. So when the egg is not released from your ovaries, the chances of you having menstruation will be minimal. So you can stay up to 3 months, 4 months, 6 months without experiencing your menstrual period. So that should not be a case for you to worry about. The final cause of amenorrhea, the final cause of secondary amenorrhea is ovarian cyst, or something we call polycystic ovarian disease. So an ovarian cyst is an inflammation. It's a cyst. It's something like in layman's language, I can say it is something like a boil. Do you know a boil? Something with pus inside, pus or water. So sometimes your ovary might develop cysts. Sometimes. So cysts are very painful because they are something that is not normal in the body. So when you have, so the presence of cysts, having one cyst at a time might not be a problem. But when you have chronic ovarian cysts, or when they keep on coming, you keep on having the ovarian cysts, they might interfere with the ovulation. They will interfere with the release of the eggs. So in the end, you will not have menstruation. On the other hand, we have a disease called polycystic ovarian disease. This is a condition whereby you will find that it will lessen the number of eggs being released. So these people will find that they will be having very irregular menstrual periods, and they will also, at one point, they might not have menstrual period because these two conditions will interfere with the production of the eggs. So in the end, you will find that they will not have menstruation. So I've come to the end of my video whereby I've talked about the real causes of secondary, the real process of amenorrhea. So anytime, the other time when you find that you have missed your menstrual period and you have done a pregnancy test and you find that you're not pregnant, you must assess yourself. Are you undergoing any form of stress, or are there any events that have happened in your life? Maybe somebody has died, or are you overthinking about something, or have you fainted? Have you had a case of fainting in the past few years or few months? Have you bled a lot during your last childbirth? So you can look at these characteristics. So when you look at this, that's when you can find what is really causing you not to have your menstrual periods. So understanding what is causing you not to have menstrual period will be essential, because it will also help you in knowing how to solve it. So if you have any question or if you have any concern, please put them down in the comment section below. I'll be more than happy to respond to them. So most of these causes can be treated and should not be of worry to you. So with that said and done, I've come to the end of my video. If you have not subscribed, please consider subscribing. Don't forget to like the video and also put a comment down in the comment section below.